is Jenny Patton. I am the Operations Manager for Springfield Clinic Orthopedic Surgery and Podiatry. So for my department specifically, I have about 120 positions that would include clinical staff and then our non-clinical staff. And so I think really for us to have everyone working together is really, it's just all about the continuum of care for patient.
My name's Jessica Snodgrass. I have been with Springfield Clinic for 2.5 years now. I started in cardiology as the clinical lead and then was promoted to operations manager. So that's the current role that I'm in.
I think the medical assistant role is definitely growing within our clinics in particular. I know that, when I started in this group 6 years ago, we had mostly RNs with a couple LPNs here and there. And now almost every team has a medical assistant. We've got medical assistants running entire clinics for our advanced practitioners. And so they just have been a very important part of kind of what we're going and what we're growing towards. And so the demand for them has significantly increased over the last couple of years.
The CMA, when they're in the clinic setting, they will get the patient from the waiting room, they verify the date of birth, the name, they bring them back to the exam room, get their weight, blood pressure, pulse, all of the vital signs, and then they review some questions with them, and pretty much they get how the patient's feeling and get that patient ready for the doctor. They kind of like set the tone for the visit.
I think our partnership with MTI has really brought a whole new perspective to the table. I think, from my perspective before this, you're really bringing somebody in and you might sit with them for 30 to 60 minutes and kind of get a feel for who they are, and you're going to guess that it's going to be a good hire, that's going to be a good fit. And so having the externship opportunity has really been integral for us building our team, because we get somebody in here, we can really coach them through that initial learning and kind of working through what it's going to be like in this environment. And so I think it gives them a real life opportunity to understand what this is going to be like. So for us, it's a nice, several week-long interview where we get to really learn who they are and they get to learn who we are, and we can understand if this is going to be a good fit, if it's something that they want to continue to pursue, or if it's something, that's going to work out for both of us. So it's been really, really good.
I feel like the MTI externs are very prepared for the clinical settings when they come to us. The background that they're getting definitely prepares them for the hands-on experience that they're going to get.
My experience at MTI was overall really good. The teachers were really great. The classes being smaller sizes that they are, you get a lot of that more one-on-one time and direct learning. So if you're struggling with a certain topic, they really take the time to help you out, and they offer, I've had teachers stay after helping me with things, and they're just really helpful when it comes to that aspect, and they're really good at placement. Like, I got placed in my externship really soon, did that, and then was hired directly after that at the clinic here. And there's always new things you're learning, especially when COVID came, you had to learn to adapt very quickly, but overall there's nothing you really had to relearn, because MTI really prepares you for all that.
I feel like the training alone, even without the externship, like as long as you're paying attention and you're following directions and you're actually closely looking at what you're doing with the training and all the book work, coming to externship is a breeze. Anything that they threw at me, like even if I felt like I didn't know it, it was kind of already second nature. I knew it.
I would say everything we learn has prepared us for when we go into that externship. They teach you everything you need to know. Every place is different on the skills you need. Like cardiology, there's obviously some stuff you have to learn because you go over everything, but it's only small amounts of everything. That's why the externship is very helpful. They help you learn those little things.
I think if someone is interested in becoming a CMA, MTI is a great institution to choose. Their students are very well prepared, they get a lot of clinical hours, and they do partner with us here at Springfield Clinic. And Springfield Clinic's a great organization to work for. I think going to MTI, because of that externship, it's a good stepping stone into the medical field.